So the question is, when should patients be referred to a fertility specialist? And there are many, many different opinions on this. And some OBGYNs have a good deal of experience in this area, and it's of special interest to them. And I think it's absolutely fine, of course, for them to decide that they want to do at least the initial stages of evaluation and treatment themselves before they refer the patient to the fertility specialist. On the other hand, other OBGYNs have very little interest in this or just simply don't have the time to focus on it, and so they refer earlier, they refer sooner. So that's one way of looking at it. Another way of looking at it is age. And so generally before the age of 35, I think perfectly reasonable for anyone who's interested to do the initial evaluation and treatment. It's very important to look at the cause. Some causes are relatively simple to treat and others are much more complicated. So I would look carefully at that and make sure that you feel like that's something that you actually want to deal with, something that you have experience dealing with. Now, above the age of 35 and when there's diminished ovarian reserve, I think the vast majority of those cases, it's better to send to a fertility specialist because the patient may not have that much time left in order to become pregnant, especially to become pregnant with a number of children that they anticipate that they're going to want. I get called about this very, very commonly, and feel free to call me. I'm happy to go over any cases that you have. I'll give you my recommendations for what to do should you decide to care for them. I'll give you my recommendation on whether or not I think it's ideal for the patient to have you take care of them or refer them to a fertility specialist. So this is an area, as I said, that is wide open. And I'm happy to hear any comments you have about this and happy to take any questions you might have.